Welcome to today's class on radiology, focusing specifically on the topic of contrast agents and their administration in CT imaging. In this comprehensive script, we will dive into the various aspects related to contrast agents, including their types, routes of administration, potential risks and complications, dosage calculations, patient preparation, management strategies for adverse reactions, and much more. Now, let's begin our exploration with an introduction to contrast agents and their importance in CT imaging. Iodinated contrast agents are important for improving visibility in CT scans. They come in two categories, low-osmolar and iso-osmolar. Low-osmolar agents, such as iohexol and iopamidol, reduce adverse reactions. Iso-osmolar agents, like iodixonol, are well tolerated by high-risk patients. Different agents have specific indications, allowing radiologists to choose the best option for each scenario and improve CT imaging quality. In CT imaging, contrast agents can be administered intravenously, orally, rectally, or intra-articularly. Each route has specific purposes, such as enhancing overall body visualization, delineating the gastrointestinal tract, improving rectal and pelvic imaging, and assessing joint structures. Contrast agents used in CT scans can have potential risks, such as allergic reactions, contrast-induced nephropathy, extravasation, and thyroid dysfunction. Radiologists must be aware of these risks, pre-screen patients, and take appropriate measures to prevent and manage adverse events. To determine the appropriate contrast dosage in CT imaging, factors like patient weight, imaging protocol, and anatomical region are considered. The dosage is typically expressed in ml/kg and ranges between 1 to 2 ml/kg for intravenous administration. Power injectors provide precise control, while optimal timing is crucial for capturing contrast enhancement. Patient preparation plays a crucial role in the success of contrast-enhanced CT scans. It involves fasting before abdominal scans, screening for allergies to contrast agents, and obtaining informed consent. These measures ensure patient safety and improve the quality of imaging for accurate diagnosis. Contrast extravasation during injection is rare but can cause complications. Steps to manage it include stopping the injection, elevating the affected limb, applying warm or cold compresses, and monitoring for complications. Prompt recognition and management are crucial to prevent harm and ensure patient comfort. SIN is kidney dysfunction that can happen after contrast administration, especially in those with existing kidney problems. Risk factors include pre-existing renal dysfunction, diabetes, dehydration, heart failure, and nephrotoxic drug use. Preventive measures include hydration, limited contrast volume, and considering alternative imaging. Management involves supportive care and involving nephrologists if needed. Radiologists can play a role in reducing SIN. Different contrast-enhanced CT imaging protocols are employed based on the clinical question at hand and the anatomical region of interest. Some commonly utilized protocols include 1. Arterial phase imaging. This imaging phase is performed immediately after the injection of contrast material, capturing the dynamic arterial enhancement patterns. It is valuable for vascular and oncological studies, providing information about tumor vascularity and vascular abnormalities. 2. Venous phase imaging. This phase occurs when the contrast agent reaches the venous system, highlighting the hepatic and portal venous structures. It is particularly useful for evaluating solid organ characteristics, such as liver lesions or hepatic metastases. 3. Delayed phase imaging. Delayed phase imaging occurs several minutes after contrast administration. It helps visualize late-occurring enhancements, such as certain tumors or selecting specific time points to assess biliary excretion or urinary tract abnormalities. Understanding the various contrast-enhanced CT imaging protocols allows radiologists to optimize the acquisition parameters, contrast timing, and scan sequences, thereby providing comprehensive diagnostic information specific to the clinical question. To summarize, safe administration of contrast media in pregnant patients, children, and individuals with impaired renal function requires minimizing radiation and risks to fetus, using low doses in pediatric populations, and applying precautions for renal function in patients with impaired kidneys. During a contrast-enhanced CT scan, several artifacts and challenges can affect image quality. Beam hardening artifacts, motion artifacts, and timing errors are common. Radiologists should be familiar with these artifacts to ensure accurate interpretation and avoid diagnostic errors. Dual energy CT, DECT, and spectral imaging techniques have revolutionized contrast-enhanced CT by providing additional diagnostic information through the assessment of tissue composition and functional data. These advanced techniques offer unique advantages, including 1. Material decomposition. DECT enables the differentiation of various materials based on their atomic composition, enhancing the characterization of lesions, such as distinguishing between iodine, calcifications, or hemorrhage within a given region. 2. Virtual non-contrast imaging. Spectral imaging technology allows the generation of virtual non-contrast images by separating the contrast enhancement from the non-contrast dataset. This aids in the assessment of lesions, especially those with contraindications for contrast administration. 3. Improved iodine quantification. Both DECT and spectral imaging techniques provide the capability to quantify iodine uptake, assisting in the evaluation of perfusion abnormalities, tumor vascularity, and potential treatment response assessment. Though these advanced techniques require specific hardware and software capabilities, they offer valuable additional information, improving the diagnostic accuracy and expanding the clinical utility of contrast-enhanced CT imaging. In urgent or emergent situations like trauma or acute stroke, contrast administration protocols are designed to quickly and safely provide necessary imaging. Rapid patient assessment, identification of contraindications, expedited imaging protocols, and team coordination are critical for efficient patient management and timely intervention. In conclusion, we have covered the key aspects of CT contrast administration and protocols. This includes understanding different contrast agents, their administration routes, associated risks and complications, dosage calculations, patient preparation, extravasation management, and considerations for special populations. We also discussed contrast-enhanced CT imaging protocols, artifacts, challenges, advanced techniques, and protocols for urgent situations. This knowledge is essential for providing safe and high-quality patient care in radiology.